Mr. Smith, it's Tori, and I'm here from the respiratory department, and I'm going to do sterile nasal tracheal suction for you today. You've already got your nasal airway placed, so I'm just going to go ahead and get you hyperoxygenated, and we'll go ahead and do suction. So go ahead and apply gloves. Wash my hands, of course. Apply gloves. And since Mr. Smith already has his nasal airway in, we don't need to do that. But I am going to hyperoxygenate my patient using a non-rebreather for at least 30 seconds before we do the sterile nasal tracheal suction, so that our patient is better able to withstand the procedure. Of course, this would have a bag if it was a real non-rebreather mask. So once I get my patient hyperoxygenated, we're going to go ahead and get ready to suction. So I'm going to go ahead and wash my hands, and then I need to aseptically open the sterile catheter set. So I'll go ahead and do that and apply the sterile gloves. I'm going to go ahead and put some saline into my little catheter tray. I'm going to hook my catheter up to suction, and for this adult it's going to be -120 to -150. To make sure that my suction's working once it's hooked up, I'm going to put the catheter into the sterile saline and include the thumb port to make sure that my suction is properly working before I begin my suction. And then the next thing that I'm going to do is put a little bit of the Surgilube water soluble into my hand, and I'm just going to run the catheter through it to lubricate my catheter before we get started. So I'm going to go ahead and just wrap that around my hand. Okay, and I'm going to go ahead and insert the catheter until I can see like condensation inside of it, which is telling me that we're in the trachea, also, or like until the patient would cough. So go ahead and insert, and we're not suctioning yet, we're just inserting. Okay, and then my patient coughs, so we're going to retract, and we're going to begin to suction on the way out, which should take less than 15 seconds. Okay, then with my non-sterile hand, I'm going to go ahead and re-oxygenate my patient for about 1 minute after the process of suction. I can use that sterile solution, sterile saline, to clean out the catheter, or if it's a disposable catheter, you can just go ahead and dispose of that properly. So I went ahead and re-oxygenated my patient and disposed of all of our waste. I've made sure my patient is doing okay. I've assessed him, and alright, I will be back. I'll be back here after a while to check on you again, okay? Thank you.